My name is Melissa Engel, and I am first author of the paper Early Life Somatic Complaints, Longitudinal Associations with Maternal and Child Psychopathology, published in the Journal of Developmental and Behavioral Pediatrics. Currently, I am a PhD student at the Institute of Child Development at the University of Minnesota, where I work in the laboratory of Dr. Megan Gunner. The work that I am going to tell you about today was my honors thesis when I was an undergraduate at Emory University under the mentorship of Dr. Patricia Brennan. Somatic complaints refer to physical symptoms such as headaches, abdominal pain, or dizziness with no identifiable organic cause. These symptoms are common in children, affecting 10 to 30% of youth in the United States and accounting for 2 to 4% of pediatrician visits. In addition to resulting in significant functional impairment, somatic complaints are associated with emotional and behavioral problems and often lead to excessive school absences. Most concerning, though, is that somatic complaints in childhood often forecast anxiety and depressive disorders of adulthood. Previous work has longitudinally examined somatic complaints in older children and in adolescents. However, less is known about the persistence and behavioral correlates of somatic complaints as early as the preschool years. Maternal psychopathology has also been examined in relation to child somatic complaints, with the majority of the literature focusing on maternal anxiety as a risk factor. Less is known, though, about the potential role of maternal depression, maternal psychopathology in general, or the role of maternal reporting bias. To address these gaps, we longitudinally examined the development of somatic complaints from preschool to school age in a community sample of children at high risk for psychopathology. We recruited 185 mothers, the majority of whom had a history of psychopathology. When children were in preschool, we brought mothers and children into the lab, and we followed up via electronic questionnaires once children were at school age. At each time point, we asked mothers, as well as a secondary caregiver, such as a father or a grandparent, questions regarding children's somatic complaints, anxiety, and depressive symptoms. We assessed maternal psychopathology as well. So, what did we find? First of all, the prevalence of somatic complaints in our sample was high, far greater than that reported in previous community samples. Over 60% of preschool-aged children and nearly 50% of school-aged children were reported to have experienced at least one somatic complaint. This suggests that maternal psychopathology is indeed a risk factor for child somatic complaints. When we examined the relationship between child somatic complaints and maternal anxiety, maternal depression, and maternal psychopathology more broadly, a complex picture emerged, which I encourage you to read more about in our full article. Now, on to the longitudinal findings. Children who experienced somatic complaints at preschool were significantly more likely to experience somatic complaints at school age. Moreover, these children who experienced early somatic complaints had heightened anxiety and depressive symptoms at school age, even after accounting for their baseline anxiety and depression. Recently, some have suggested that a latent internalizing factor may underlie somatic complaints, anxiety, and depression. Our results support this hypothesis and suggest that somatic complaints may be an early behavioral manifestation of anxiety and depression. Warning signs of internalizing disorders may be evident as early as the preschool years, which brings important opportunities for early intervention. Pediatric primary care is an ideal setting to integrate such preventative efforts, as parents often bring their children to the pediatrician long before they may seek appropriate mental health care for their children. Future directions should seek to develop evidence-based screening measures for somatic complaints in young children. However, in the meantime, pediatricians can ask parents simple questions such as, does your child experience frequent aches and pains at pediatric well child visits? Doing so may go a long way in helping to prevent internalizing disorders. Thank you, and I hope you enjoy our article.